Yes.
The Secretary has to testify.
Thank you, Mr. Speaker. The first note's a little bit self-serving. It's Giving Tuesday, and so just asking everyone to consider perhaps public television among the many worthy charities. Louisiana Public Television, one of the best.
Yes, there's a plea to give to public television for Giving Tuesday. Okay.
And then on healthcare, two of your members came out of the meeting just now and told me that it was their impression that the House Republicans are likely to get on board some kind of short-term extension for the subsidies while you work out long-term reform. They weren't members who love that idea, but they said it looks like that might be necessary. Where do you think things stand, and could something come before the House by the end of the year?
I don't know who you talked to, but they might have left early. I was up there for quite a bit today. We were talking about a lot of issues, and what I said, we didn't commit to that. What I said is, when you have, this is just practical, okay? When you have a razor-thin majority, which we have, this is not like the old days. You know, in the old days, they had 30, 40-seat majorities, and so 4 leaders could go in a back room, create the agenda, and hoist it upon everybody and say, this is what you're doing. And if 20 or 25 people disagreed, they said, so what? Go jump in the Potomac. We're moving forward. Okay, it doesn't work that way, right? And when in an era of small margins, I literally have to get almost every person in the room on board. Now, healthcare is a very complex issue. And I don't want to point this out. Look, it is not the Republicans who broke American healthcare. Next week, we'll go into this in real detail, and I'll show you the whole timeline. The Democrats broke healthcare, okay? When they created the Unaffordable Care Act 15 years ago, they promised you that everybody could keep your plan, keep your doctor if you want it, and that your premiums would be reduced on average by $2,500. Exactly the opposite was the truth, and premiums have risen in some cases 60, 80% over that time. They broke the system, and every time the Democrats have gone in to try to subsidize the broken system, they've spent more and more taxpayer dollars, and they've been wasted. The COVID-era subsidy only affects 7% of Americans. Okay, all this hullabaloo is over 7%. Now, every American, 100% of Americans need their health care costs to come down. Republicans have ideas to do that. Now, what I've got to do is build consensus deliberately around the best ideas, and we've been working on that. The majority leader has been quarterbacking this effort with the chairman of the committees of jurisdiction, with the Docs Caucus, and with individual members who this is their passion, and they really spend a lot of time thinking and working on it. And we're pulling those ideas together, and there will be a Republican response to this, okay? So I can't project in advance what that will be, because I don't know what the consensus is in that room, but you will see our sleeves rolled up and that work being done in earnest this week as we bring all that together. I told everybody we are going to respond. We understand the need of bringing down healthcare costs and at the same time raising access to care and quality of care. The Republican Party is the party that can do that. The Democrats have demonstrated for 15 years they broke the system, and they keep doubling down on the broken system, okay? Hey, and guess what? If you love your Obamacare, you'll get to keep it, okay? We're going to improve the system for Americans. We have good ideas to do it. We have a lot of thoughtful people working on this, and we'll be pulling it together. So, no, the answer is no, I did not project any outcome of this morning. We were talking about the various ideas, and we're working right now. People are very passionate about this, and they should be, because their constituents understand the necessity of it. So we'll keep doing that. Thank you all so much, and be more later today.